And good morning, I'm Mabel Jong. Thanks for joining us. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. In our studio right now is Gary Jacobs, Executive VP of CareCentrix. Welcome, Gary.
Hi. Welcome, thank you.
Well, tell me first what CareCentrix is.
So CareCentrix has been around for 20 years. We're a home care benefits management company, and we work with payers and coordinate their home care services.
Okay, and is home care structured differently than what we see as facility care?
Yes, and it's evolving really quickly, which is kind of what excited me about becoming involved with our company. Home care used to be you'd finish an episode of care in a hospital, you'd go home, and you would get a couple of visits from a nurse or a home health aide or a physical therapist or speech or occupational therapist. And they would just finish your course of treatment. Now, home care is really turning the corner to become an element of this new value-based care we hear so much about, which I'll explain to you later on, hopefully.
So we actually are seeing home care as part of the foundation for this change on the healthcare landscape then.
Oh my gosh,
That's
yeah.
really being
I
considered.
think that what is beginning is this kind of reinvention of the model of home care around value-based care in a way that it's redefining quality, and what payers are starting to realize is that by having somebody at home, you can reduce readmissions to hospitals, which is a big cost driver for them, let alone opens the door to post-acute care, and the whole role that home care can play is the place where people want to recover and want to be, as opposed to being an institution.
Okay. How is it being managed on the payer side? Are there definitions that are being rewritten as to what it should be paid for and how much it should be costing?
So I've been a payer most of my career, and I've in the middle owned a home health agency that ended up taking risk from payers. So I kind of know from where I speak on this fairly well. Most health plans don't really understand the home care benefit and how to utilize it appropriately. And it's not a negative, it's just an unfortunate fact that if they could figure it out and learn from what people like us have learned, home care could become the linchpin of a value-based solution to promote, again, higher quality and to lower overall spend. I can give you some examples of how that might work.
Please do.
Okay, so let's talk about post-acute in general. Post-acute in a Medicare population might equate to about 30% of the overall spend. 70% of home care, 70% of post-acute utilization is really tied to institutional care. And it typically is upon discharge from the hospital, people go into a skilled nursing facility or an LTAC or an IRF or one of these rehab centers because it's the way things have always been done. It's what I would call institutional bias. It's not good or bad, it's just the way things have been done. So what we're able to do now with the reinvention of home care is to equip a home to make it almost like a hospital setting with telemetry and all the new devices that you can put into a home now and monitor somebody in a way you couldn't monitor them before. It's where the patient wants to be, and it's typically a lower cost setting. So from a post-acute perspective, if we can get somebody to redirect it from an institution to home quicker, sooner, faster, A, they want to be there, and B, we believe we can save a significant amount of money.
What is preventing that discussion being more at the forefront now?
I think it's education. And it's presentations like we gave today and talking to payers on a more routine basis, and having the analytics to back up what we're saying. So I can walk into your office if you're a CEO of a health plan, and I can show you what your utilization, let's say for post-acute services, looks like today, and then I can map out what we can do in your community, given the resources that exist, even if you own some of those resources, to direct your patients in a more cost-efficient quality, to more cost-efficient quality providers, and show a better result.
Okay.
Which is mind-boggling.
Absolutely. Now, do you feel that this is actually a good environment in which to have this discussion? Are people more open to this idea being more of a concrete solution to lowering costs and providing care that the patient themselves want?
It seemed to me from our session that there were enough, there's been enough discussion over the last day and a half about the issues around value-based care and about the public policy that's driven it, that they're open to reinventing post-acute care. And I don't think anybody's really talked to them about the role home care can play in that. And that was what was terribly exciting about being able to do that. And I think that it gives us the ability to now broaden that conversation to many more people, and including the home health agencies, so they can perform at the top of their license.
What is the overriding takeaway you want to leave people with here at this conference?
That in a environment of change like we're going through today, if the tools are in place that include technology, a platform that can be operable for all the players, the patient, the provider, and the payer, and us as the network manager in this case. And if your and your analytics give you the capability to identify the right site of service at the right time based on your condition and your transition from one phase to the next, that it's a more consumer-friendly, preferable, and more cost-efficient way to receive services upon discharge from a hospital. And by doing that, I think we would educate people to something they haven't really thought about before, and play a bigger role in the future of healthcare going forward. As an example, one last point, managed long-term care. So a state like New York, $6 billion the state spends a year on Medicaid long-term care expenses, which include nursing homes and all the costs related to nursing homes, home care, etc. The Medicaid director and I talked about this recently, and he said the public policy moved us to capitate with providers to create managed long-term care plans so we could fix our cost and put the burden on the providers and the payers to assume that cost, which is what Medicaid's doing around the country. To effectively play in that, you can't just say, I want to be a provider. You need the analytic capability to analyze a population, manage a population, and then have the delivery system capable of providing those services and truly know your cost so you can compete in a new environment like that. Same with bundled payments. The federal government is moved towards. And the last point is that there's now a federal demonstration in 9 states that Medicare certified home health agencies are having withholds of payment tied to performance. So everybody's moving directionally this way. We're just facilitating that by being on top of it and being the interface between the providers and the payers.
Excellent. Now, why did you think it was important to put the World Healthcare Congress in your calendar this year?
because honestly, I go to a lot of meetings every year throughout my career, and when World Congress merged all of these conferences to this one World Congress, you get a great cross-section of industry thinkers, leaders, and people that are changing paradigms, and they are happy to speak about it. So it's a great environment to take an incubated idea and to bring it towards maturation, which I love doing. And from this, we got enough positive feedback that it'll shape our messaging as we go forward now into telling people more and more about it so they buy the services.
All right.
So I think it's perfect.
Gary Jacobs, thank you so much for your time today.
Thank you.
And I'm Mabel Jong. Thank you for watching. Still more to come.